Hi, it's Atul Kamath of Kamath Orthopedics, hip and knee specialist. I want to teach you a little bit about gluteal or abductor muscle injuries about the hip. This can be somewhat overlooked and sometimes not well understood as patients can complain of pain on the outside of the hip, and this may be treated initially as bursitis or tendonitis on the outside of the hip. Usually the pain is located laterally or at the bump of bone on the side of the hip. However, gluteal or abductor muscle tear is a little bit more advanced condition where the muscles or the tendons around the hip are actually injured. And so this may be more than just bursitis, but may be initially treated as bursitis type pain. When we talk about the hip abductors, there's really three major abductor muscles or gluteal muscles. And you may be familiar with the gluteus maximus. The gluteus medius is another tendon, that means the middle one, and the gluteus minimus is the smallest one. So we have the maximus, large, middle, and small tendons. And when we take a look at a hip model, this is a view of your hip, this is the hip joint, and when we talk about pain on the outside of the hip, this is the lateral or abductor pain that may be treated initially as bursitis. So leaning on that side or sleeping on that side may cause pain on the outer bump or this muscle. This is the gluteus maximus muscle. As you can see, it's the very large muscle on the back of the gluteus muscle. If we were to take this away, then we would see that there are other gluteal muscles here as well. There's a minimus and a medius, and these are smaller tendons, but if they're injured or they're in pain, they can cause significant imbalances of the pelvis, can cause a lot of limping, and again, lots of pain. And so this muscles, if they're torn or injured, and commonly it's the medius and oftentimes the minimus as well, they can really be a source of pain about the outer part of the hip. And so while the hip joint articulation, or where the ball meets the socket, is here and more towards the groin, can be pain on the outer part of the hip. There are different treatments for this, including physical therapy, other pain medications. Sometimes I prescribe a hip brace to stabilize this. And those are usually for things like partial tears or just tendonitis. But when we get a little bit more than that, we can try things like biologic injections for tendonitis to stimulate some healing and help with pain. And then again, if we need to keep climbing the ladder, if there are full thickness tears or tears that are not attached to the bone, that's where surgical intervention may be needed. And that's where I can repair primarily tendons down to the bone for more acute tears or tears that do not have associated atrophy. For more advanced tears around the trochanter, I may have to augment the tissue either with an augment or a patch. And then sometimes I actually have to transfer other muscle locally that's healthy to help treat a tear about the hip joint. So it's that ladder of reconstruction or that ladder of treatment that I afford for things like hip abductor tears. So in general, hip abductor tears or gluteal tears can be relatively unrecognized. Sometimes there's other conditions like spine, radicular sciatica type pains that feel like buttock pains or gluteal pains. But really, from the standpoint, it takes a hip specialist to understand that based on careful history and physical examination. And then I might order other additional studies like an MRI or an ultrasound, either for diagnostic or therapeutic reasons. And then in the hands of a hip specialist who routinely treats these surgically, I may do either open or arthroscopic treatments to repair the tendons and help you get that functional stability of the pelvis. So if you're having pain about the hip that's going on for some time and you've tried non-surgical conservative measures like physical therapy or bracing, it may be time to get a further evaluation by an orthopedic hip specialist. And here at Kamath Orthopedics, would love to take care of you, understand your pain symptoms, understand your history, and then really discuss with you different treatment options that may be amenable to helping you get you back on the road to recovery. So look forward to seeing you at Kamath Orthopedics. Looking forward to understanding your hip conditions more closely, and we'll see you soon. Take care.